Dr. Gary Rademacher here from Downtown's Healthcare, and welcome back to our regenerative medicine video blog. Thank you for tuning in. My team at Downtown's Healthcare have decided to start sharing information on regenerative medicine to help our patients and consumers understand the facts about regenerative medicine and to dispel the myths so that you may make an informed decision. First and foremost, we are the best. Our medical team consists of Dr. Feldman, Karen Rea, NP, Jennifer Fightmaster, NP. We've been doing this for over 5 years now, and Karen Rea has actually trained over 500 providers on injections, ultrasound-guided injections, and is a key opinion leader for several labs throughout the country. One of the questions that we get is what type of regenerative medicine stem cells are there? And there's bone marrow, there's fat, there's umbilical cord tissue, there's amniotic tissue, there's PRP. I think what's important to understand is that there's a lot of rhetoric out there right now, but like PRP and amniotic tissue does not have stem cells in it. In fact, umbilical cord blood does not have stem cells in it. They have hematopoietic stem cells in umbilical cord blood, but you don't have MSCs. Your mesenchymal stem cells are only found in bone marrow, fat, and umbilical cord tissue. So you have to be very careful when you're talking to other providers and what types of treatment you're getting. In our office, we do many different types of treatments, and it just depends on what's going on with the individual. Some of those treatments will have stem cells in them, and some won't. But in essence, what we found is this matrix of cells, not just stem cells, that actually helps the individual get better and feel better. So, but the question we often get is, what is the best source? And I'm just going to quote, Neil Reardon, who's a doctor who's been doing regenerative medicine, probably one of the ones that's been doing it the longest. And quote, he states, "Younger cells, as found in umbilical cords, are more energetic in the system and hence have a better chance of persisting and being more effective." End quote. Next quote, "First, I believe the best stem cells, the ones with the best healing and regenerative power, as well as the fewest complications, are adult stem cells, which can be obtained from donated umbilical cord tissue from healthy live births." End quote. Next quote, "So umbilical MSCs, which come from discarded tissue, are just as good as your own MSCs." End quote. Dr. Reardon actually wrote a book, Rising Tide, how stem cells are disrupting medicine and transforming lives. Great read. I'm getting these quotes out of his book. A few more quotes here. Quote, "Not only does the number of mesenchymal stem cells decline as we age, but so does their robustness. Mesenchymal stem cell robustness is determined by a few main factors: the rate at which the cells multiply or double, the amount of trophic factors they produce, and the senescence or deterioration." End quote. Quote, "MSCs in older individuals do not multiply or double as quickly, nor do they produce as many healing trophic factors as do cells in younger individuals." End quote. Last quote, "This explains why umbilical cord MSCs are so potent. They come from a very young, healthy human being. We have found that umbilical cord MSCs are the most potent when compared to bone marrow, fat, menstrual cell MSCs, all of which we have used extensively and extensively tested." So, what is the best source? Really, it kind of comes down to the individual again. If someone is aging, we typically, older, we typically stay away from bone marrow and fat. We'd rather use donor tissue like umbilical cord tissue. And we love using Predictive Biotech, which is a lab that basically uses umbilical cord tissue. They use the tissue from the Wharton's jelly portion of the umbilical tissue, and they've done third-party testing. Their product, CoreSite, actually has been shown to have 1.1 million cells per milliliter. So we think they're a very reputable company. So I'd like to invite you to learn more about Downtown's Healthcare. We offer solutions to pain that does not include drugs or surgery. Call our office to schedule a consultation and screening at 303-292-9992. Click the link below for more information and or to schedule a time to get checked out. Lastly, we need your help. Our purpose is to help as many people as we possibly can to get off of medications, avoid unnecessary surgeries. We're not by any means against those things when they are needed, but in this society today, we are abusing both of those. Please forward this email to your friends and family. Help us help others. If you know of someone we could possibly help, send this email to them, and they also can click on the links below for a free consultation. Have a great day. If you do have any questions, please call 303-292-9992. Make it a great day. And until next time, stay healthy.